What will you do if years of education, long hours, and even caring for others was not enough to support your own family? Hi, everyone. My name is Cristal Soemi, and as part of my final project here in my last semester at UCF, I will be analyzing the sociological aspects of what is making nurses leave the island of Puerto Rico and move here into the US. Over the past decade, Puerto Rico has faced many challenges in which we can name a couple: Hurricane Maria in 2017, earthquakes going through the south area of Puerto Rico, followed by COVID 19, and a lot of economic and governmental issues that have put a strain in the healthcare system overall. At the same time, we've seen an increase of numbers of nurses and even other providers just deciding to leave the island for better opportunities in the mainland or any other state in the United States. As someone who was born and raised in Puerto Rico, this topic is deeply meaningful for me, especially having a mom that worked so many years as a med surg nurse, and even having an aunt that, even though she's retired, she served many years as an ICU nurse, also in the same hospital. This experience that having both of them in my life gave me an early understanding of the deep meaning and work a nurse can do within the healthcare system and the role that plays the nurse in the healthcare overall. So later, I actually worked as a certified nurse assistant here in the state of Florida, in which I still am licensed. And this experience also gave me the opportunity to care for patients and work alongside with many nurses, including several that migrated from Puerto Rico. Probably with the experience that I've had personal, I could kind of understand why nurses have migrated from Puerto Rico to the US. However, I became really interested understanding the why behind it deeply and why they choose to leave the island. Is this decision of the migration of nurses primarily driven by the salary? Because we can see there's a big difference. However, have we ever thought about any deeper social or professional factors influencing this huge decision? Project that I'm about to share with you today examines sociological factors associated with the exodus of nursing personnel from Puerto Rico and explores how these factors overall affect the healthcare workers, patients, and healthcare system as a whole. Finding sources in order to put together this project was a big of a challenge because finding specific research about nursing personnel, it was one of the most challenging parts. However, I could say that Puerto Rico has faced significant challenges throughout many years that has passed, and we can tell that there was natural disaster, pandemic, other things that also intensify the problems. However, there are some research out there that can argue that the issues existed before all of these events occurred. Following Hurricane Maria, healthcare facilities struggled with power outage, resource shortage, damaged infrastructure, and workforce limitations. Similar challenges were also emerged during the earthquakes and later during the COVID-19 pandemic. There was a research conducted by Alvarez and some colleagues that they found that healthcare workers in Puerto Rico reported high levels of burnout, stress, emotional exhaustion, and lack of administrative support during the pandemic. This findings suggest that the healthcare workers were expected to continue providing the care despite the difficult working condition and limited resources. Since last summer, we know that a lot of nurses have vocalized and publicly expressed the frustration regarding excessive workloads, staffing shortage, and what they perceive as a healthcare system that is struggling to meet the needs of both the patient and the healthcare professional. I feel like this is a struggle that is not only seen in Puerto Rico, but also in the United States. But I do want to focus the project on Puerto Rico specifically because, later on in this project, you will see that they are the worst paid in US territory. And also, there are many challenges that probably other states had not faced, including the natural disasters that we mentioned before, and other things and challenges that we can see that the staff shortage is very significant. So, one of the biggest challenges, like I mentioned before, during this research was the lack of available research. While there's extensive literature of physician migration, there's very little about nurses. I also found a couple that were mainly for mental health care providers, besides the physicians, but for nurses specifically, there is not a lot of data out there. One of the studies by Betancourt identifies several factors that may contribute to the nurse migration. This include low salaries that we're going to talk about in a little further, poor working conditions, excessive work hours, limited resources, and burnout. Among the factors that we just mentioned, we all know that the salary difference is the main thing that people focus on. And if you can see under the US Department of Labor, in which has the information of the average salary in each state, in Puerto Rico, nurses' average annual salary of a registered nurse is 37,780. If we compare it to the average annual salary in the US, which is $93,600. There is some debate on the cost of living in Puerto Rico versus the cost of living in the US. And that's definitely an opportunity for further research. But for now, we just want to see the bigger picture of how we compare in this two average and to give you a little bit more perspective on the difference between the two salaries. Right now, if you are a registered nurse with a bachelor's degree in Puerto Rico, giving you an average, this is not a rural area, not no specific area, more of like an average amount. They do about $18 per hour. And kind of the same wage or kind of the same average salary per hour, it's what at least I did as a CNA here in Florida. And with differentials, sometimes even more. So that's to give you a little bit of numbers or a better perspective in terms of cost of living. We can compare, but still, it is way below average. And this comparison gains significant attention in social media because once again, like you can tell that between Puerto Rico and the US, there's a huge gap. And not only that, but you can explore other wage or other salaries from other positions that do not require the license, education, or responsibility that a nurse will go through and will kind of match up the amount. So, but once again, if we think about it for a little bit, do you think that only the salary is the reason why nurses will jump into a completely new country, completely new state to provide a service, probably in a different language? Because in Puerto Rico, the classes and a lot of the things can be bilingual, but it's more Spanish based. And then going to a new country, do you think that that's the only thing that they measure how much they're going to get paid? Well, another part that I wanted to go a little bit deeper was in like the factor that involves the working conditions, especially me once again saying that I've had personal experience and personal conversations that I know that there's it's a lot more than just the salary. But this is why I want to put together this project so that we can explore other things that probably are not talked or in a conversation as much as the salary. And research and public testimony from nurses suggests that many healthcare facilities struggle with staffing shortage and excessive workloads. And we probably have heard this kind of story going around the US, talking about ratios and how many amount of patients a nurse will be able to take care of. But in my personal experience, and once again, knowing from other nurses, is that it is an amount greater than 10 per nurses. I mean, it's something that if you're a med search nurse or if you're, a less critical patient or a less critical floor, it'll definitely be a lot more than 10 patients per nurse. And then on top of that, in Puerto Rico, they only pretty much have RNs and LPNs. There's not a lot of, or I would say, I've really never heard of a CNA working in a hospital. Maybe they probably will evolve. Probably they started, but as of my knowledge, my personal knowledge, that's kind of the whole responsibility goes on to the nurse. The other staff that will assist them will be an LPN nurse. And LPN stands for licensed practical nurse. There has been a bunch of legislations and proposals in the government to kind of find a way to make regulations for the safety of the nurses and the safety of the patient. And unfortunately, it has no luck. They're still trying to bring that up in order to find ways to regulate this issue. But reports have described that nurses working extended hours and they return to work with limited recovery time and they experience significant level of burnout. And this is more when we talk about burnout, it's a lot more than just feeling exhausted. It's affecting their physical health, their mental health, their job satisfaction, and ultimately this influences the decision about whether remain in the profession in general. Because sometimes we can see that nurses even change careers. Not only they move out of the country, but they change careers. Nurses are constantly experience high stress, limited support, limited resources, and overwhelming workloads. Migration may become a little like more attractive. And in recent examples that we talked about, if we go back to summer of 2025, we remember that there was a protest called the White Flu, and there was other things that were going on in social media and like the public attention because there was a group of nurses advocating for all the nurses in Puerto Rico, right? One of the television programs in Puerto Rico called Pelotadura, it was bringing the attention, after the interview of nurses like Juan Carlos del Valle, Yasmin Ramos, Anthony Sanchez, and Barbara Besares, which they share their professional and personal experience in burnout, excessive workloads, inadequate compensation, and limited workplace support. The nurses in that program, right, in that video that you can see it on YouTube, the video is still on, and you can see the number of things that do mention on this interview, and they describe how they have large amount of patients with no CNAs or no LPNs. They have been told to perform a total care in which is also simultaneously managing the medication administration and the extensive documentation requirements. Because at least in the medical field or in the healthcare field, if it wasn't if it wasn't charted, if nobody wrote it down, it really didn't happen. So imagine having a bunch of patients that you will not only have to give medication as one of the top priorities, um, in like the everyday basis responsibilities, but also taking the assistant living, um, basic assistant living responsibilities. And then on top of that, um, having all of this documentations you need to finish at the end of the day. So some participants even reported that they've been working 12 hours for multiple consecutive days and are being required to remain at work when replacement staff fail to arrive and receive little support from management. So if we kind of go back then, in that summer, we also saw a couple of tragedies that happens because of nurses being overworked or working two shifts back to back and, ended up in tragedies in which either the nurse had an accident or having like medical errors and all of that. You can see it because not because they're not capable to perform their job, but they're completely in survival mode. And even if watching the video, you can see that each of this nurses that are part of this interview, you could tell the exhaustion, the frustration, the it's something really sad that you could tell that they want to do more, but they physically and humanly cannot. And they're just trying to find ways to kind of regulate these ratios or other things that could benefit the nurses and consequently benefit the patient. In this discussion, they did mention about the legislation, which is the bill 1035, and it's the one that established that safer nurse to patient ratios, and ultimately it was not approved. They tried to push again for it last year, and it's been in several conversations, but it's still not something that a year later has progressed. They're still kind of presenting and pushing for that to be approved or at least worked on. And several nurses expressed frustration that concerns regarding patient safety, burnout, working conditions, and, you know, had not received sufficient attention for policymakers. Through the interview in the same videos, and there's a couple of them participants emphasize the advocacy efforts were not so lightly because of wage. So they do mention that this is not just because of how much they get paid, but also they don't feel respected. Like their profession as professionals, they do not feel respected. They also have no access to benefits. There's one of them that speaks about his personal story, and it is very sad to see that someone that takes care of people and that works for the healthcare, it's not covered by health insurance, or they're not covered for like sick hours or any of that. That probably it's a lot more common, at least in my experience here in Florida. Over there is more of like a you kind of survive. And this is all spoken in this interview during this video, right? And in the conversation, you can tell that a lot of them are hesitant to leave the island or kind of stay in the island, but under other working conditions or another profession. And they do highlight how workplace conditions contribute to the ongoing migration of the nursing personnel from the island. And even though this is more of like a primary source or like it's not a research, it's based on the experience of four nurses, the feedback that it received from people around the island, this is pretty much the normal of nurses and healthcare in Puerto Rico. And like I mentioned before, my experience does match with what the four-person or four professionals express in the video. So right now, once again, we're just trying to gather all the data and continue on researching even further to understand more aspects of just like what really triggers beyond the salary. Like there's other things that has not been spoken or advocate for. And I feel like we need better understanding of what really is making most of Puerto Ricans leave the island to here to the US. Another factor that is really not talked enough is the fact that the career growth opportunities for nurses is very limited. Many nurses pursue an advanced education like a master's degree. So we know that here, at least in Florida, we have nurse practitioners that are providers. They do give they give us prescriptions, and the plan of care and everything. However, like at least in Puerto Rico, right now, last recent as a couple of months ago, there was a discussion about doing a legislation in order for give permission to nurses or nurse practitioners, which you need a master's degree and to of course be licensed to be able to prescribe medication. So right now in Puerto Rico, as a nurse practitioner, you are not legally covered or authorized to prescribe a medication. That's one of the things that is really makes a nurse or anyone pursuing growth or grow their career within the nursing to kind of see the limitations, because you are going to be either underpaid for the position that you work for as a nurse, or you're just not going to be considered because you're overqualified, if that makes sense. So having that roles that should offer flexibility and autonomy, it's really the whole opposite. So, migration may represent not only a financial decision, but also a professional development decision. After Hurricane Maria, especially, many Puerto Rican and Puerto Rican nurses have already family members or friends or professional connections living in Florida and other states. And this network makes relocation actually easier and providing information, emotional support, housing assistance, and employment opportunities. Sociologists often describe migration into like a push factors and a pull factors, right? If we go into sociology, a push factor, it's a condition that encourages someone to leave their location, right? In this example, we can see push factor as low wage, burnout, staffing shortage, and limited professional opportunities. In which the pull factor, which is what attracts them to come to the US, to Florida, and to other states, besides like, the new location, it's like higher salaries, but not only the salaries, they also have better benefits, better working conditions, and better opportunities for career advancements. I feel like this is the big one that everyone has the information flipped around, and they think that the salaries are kind of the main reason why people move or leave the island. But to be honest, it looks like there's a lot more in depth or a lot more that we're missing that really does give that contribution to give the final push for nurses or any healthcare worker at this point to kind of move to a new country or to a new city and find ways to just have less burnout, like kind of be less stressed, even though anywhere a healthcare position, especially nursing, can be stressful. But when imagine having a stressful, very demanding job and not really having a support from your colleagues, from your coworkers, from your team, from your environment at work. And then on top of that, you get no benefits. Benefits are very limited. You get a lot more work. And then on top of that, you're not acknowledged for the amount of work and physical, mental load that you are putting into. So for many nurses, especially in Puerto Rico, the combination of this like push and pull factors are more the how we can picture the migration or the influence of migrating instead of just a single issue, like probably a lot of people have said it either are the salary or the ratios. It's a lot more than just one reason why people leave or nurses leave the island. Like I mentioned before, my interest in this topic goes to the professional and personal experience. I grew up in Puerto Rico. I actually moved to Florida in 2016. So this year will be 10 years of me living here in Florida. and I've seen the dedication and the importance of nurses in the healthcare system. Like, we can see in like any resource that we see out there that nurses are the backbone of the healthcare, and it's no lie. They have a very important role that pulls everything together and kind of everything into place. And I was not only the daughter of a nurse or the niece of a nurse, I also worked alongside with multiple nurses in pediatrics and in adults. And I worked as a certified nurse assistant here in Florida. I saw so many successful Puerto Rican nurses that will give it all for their patients and will give it all for their career and for what they worked for. Unfortunately, they had to leave the island because of the conditions that they were in, and a lot of the times they don't even speak about the salary because that's kind of like an obvious a lot of the times, but that was really not what driven them. If we're gonna go further into interviews, in which I'm looking forward to do that. So if you know any nurses from Puerto Rico and that wanted to share their story, feel free to drop email on the email that I'm gonna put right here. Feel free to let me know of any nurses out there that would like to be part of an interview to dig a little deeper on this situation, right? But experiences that I've had, I feel like it really helped me understand the decision of migration. Like I said, it's a lot more complex than just the salary. And many nurses do not leave because they wanted to abandon their community. They're very conscious about how the healthcare in Puerto Rico are facing many, many challenges. And I can speak to that from myself also. Nurses, providers, and anyone that work in the healthcare system, that we do understand how challenging and frustrated can be, to want it to be or contribute to our community. Um, but once again, there's a lot of things that we need to discuss and research more to do better and to improve the quality of care. But at the end of the day, we can see that they may feel that better opportunities exist elsewhere, for supporting themselves, advancing professionally, and maintaining a sustainable quality of life. That's what we all aim for, right? Um, Once again, my personal observation alone cannot explain a social issue of this magnitude. So there's a lot of research necessary to identify patterns, measure impacts, and develop solutions. Because the main thing of projects like this is to understand a deeper level of the issue and bring this information to the table so that we can continue develop more research, and at the end of the day, hopefully create better policies and better systems to create or to continue uplifting the healthcare system, not only in Puerto Rico, but in the US. And the reason why I focus in Puerto Rico particularly was because of not only because I'm from Puerto Rico, but I feel like they face so many challenges, like natural disasters, government challenges, economic challenges in the past decade or maybe a little bit more, that I feel like this is a good opportunity for us to understand something deeper than just a salary or just like kind of the basics, like what it's really impacting the decision of a healthcare professional to not only stay in their community but stay in their role. As I think I mentioned it in the beginning, we've seen nurses moving out of Puerto Rico, but we've also seen nurses changing careers completely. And shortage of nurses and physicians and providers overall, it's everywhere, I think globally. So understanding that it's a lot more than just a salary, I feel is definitely something we should start approaching and looking forward to continue on research and continue understanding those patterns, those measures, those impact, and develop solutions for everyone. By continuing to research this issue and advocate for meaningful change, healthcare professionals, policymakers, and community leaders can work together to create conditions that allow nurses not only to succeed, but also to choose to stay. That's all I have for now. Like I mentioned before, if you know of a nurse that either migrated to US or is currently working in Puerto Rico, I believe that a lot of nurses out there kind of feel that they're not being seen or they're not being heard. I believe it's time to give them some space to express or to tell their experiences in order for us to once again understand the deeper layers of this issue that we've faced throughout the past years. So, thank you so much for watching, and thank you so much for being part of this final project in my last semester. However, this is actually the beginning of a new journey, and we're looking forward to continue on understanding and on supporting nursing personnel. Thank you so much, and have a great day.